Okay, good afternoon, everyone. I know that more people will be joining us, but we're going to try and start as promptly as possible. My name is Jane Clark. I'm one of the vice presidents of the Federation of Veterinarians. And I'm particularly excited to be here presenting this webinar on foot and mouth disease, because I was involved in the UK response in both 2001 and 2007. So very much looking forward to hearing from our presenters and our panel today. I'm just going to recap why we're here and a little bit about the FVE, and then we're going to try and spend as much time as possible with our speakers. So just a reminder of the housekeeping. The webinar will be recorded, which is really important because I want to welcome also the people who are going to be watching on record. We have exceeded our registration limit, and I know that some people will need to watch the recorded event. The slides and the recording will be shared with everyone who is interested. Please put your questions in the question and answer box. It's at the top of the Teams screen. With a little speech bubble Q&A. Please don't use the chat. We will look at the Q&A section. So if we could go on to the slides, Alice, thank you. This is our joint webinar. Previous slide, Alice. This is our joint webinar on foot and mouth disease around enhancing European resilience and taking insights from the recent FMD outbreaks and also thinking about future control strategies. Next slide, please, Alice. For anyone who isn't familiar with the Federation of Veterinarians of Europe, this is a little intro slide. I encourage you to use the QR code to find out a little bit more about us. But we represent over 330,000 veterinarians across our 39 member countries. I think many of them tried to register for this event. So that has been a real success from a representative point of view. So please do go on to the website and have a look about the FVE. We go on to the next slide, Alice. Now, this webinar is one of a series. We asked our members at our General Assembly in November last year what their main animal health concerns were. And you can see from this word cloud that FMD is not there. I think that really shows how important it is to keep on our radar the unexpected. We did not expect to be dealing with foot and mouth disease in Central and Eastern Europe, and this is going to be a really great opportunity to hear from the chief veterinary officers who are actually dealing with the outbreak at the moment. And then the next slide. A very small update on the context that we're looking at here. I'm not going to go through this, but you know that we have had outbreaks in Germany, in Hungary and in Slovakia this year. And obviously we are mounting a really important response, which involves stakeholders from across the system, from the farmers to the vets, vets in private practice, vets in government. And I think it's really important that we have this opportunity to share those experiences. So if we could just finish those slides, Alice. I'm going to now introduce our first speaker. We're really pleased that Carola Sauter-Louis is the board certified veterinarian specializing in epidemiology and veterinary public health. She's currently the head of the Institute for Epidemiology at FLI, the German Federal Research Institute for Animal Health, and she's a professor at the Faculty of Agricultural and Environmental Sciences in Rostock. So, Carola, thank you so much for sharing your experiences. If I could ask you to start your presentation, and I will put myself on mute. Thank you, Carola.
Thank you very much. I'm very happy to be here. So, what is happening? Worked before.
We did do a check that it would all work, but this is live TV for you.
So does
There we
it work
go.
now?
It is perfect now, Carola. Thank you.
Thank you very much. So I'm very happy, and thank you very much for the invitation. And I'm very happy to talk about our outbreak, our little outbreak we had in Germany in the beginning of 2025. And I especially want to mention Michael Eschbaumer, who is the head of the National Reference Laboratory, and he won't be able to be here today, but he gave me some slides, and so I will try my best. So on the 10th of January, there was all over in the news, the water buffaloes are culled. So it was a confirmation of FMD, and it was the first case since 1988. And so it's a long time, and nobody really sort of had experience with foot and mouth disease. And when we look where the outbreak was, it was very close to Berlin. And it was just on the outskirts. And on the right side of the picture, you actually see the case, the location of the outbreak farm, and all the purple area, that sort of residential area. So we had a lot of residential area in Berlin, but we also had a lot of agricultural farming land on the east part of the restriction zone in Brandenburg. And at the FLI, the Friedrich Löffler Institute, it's the National Animal Health Institute for Germany, and there we have an epidemiological investigation group. And that group is actually requested through the federal states, because in Germany we have that system with the federal states, and so disease control is under the authorities of the federal states. So they request us, and then we go and we support them as much as we can. And so we did that now for FMD, but we have done that also for many other diseases. And we do that always in collaboration with the national reference laboratories and the people and staff there. And the main focus is actually the epidemiological investigations. And so it was the same on the 9th of January, we were contacted, and on the 10th of January when it was confirmed. And so colleagues of mine, they actually went onto the farm, and on the left picture, on the top left picture, you see what the weather was like that day, and it was cold, miserable. And you can imagine that sampling and culling the buffaloes was not the easiest under these circumstances. And so they were happy that anybody sort of like could help there. And these are some of the lesions which were found in the water buffaloes. And some of them, you see, they are quite, well, fairly old. They are sort of like more than 7 days or more than 5 days. And here you have some lesions, they are really, really old. Here you can see also that a lot of fibrin is already there. So these are not fresh lesions. Here you see some which is sort of a little bit reddish, so that's more fresh. And the lesions which were seen in the mouth, they were easily to detect, but the lesions in between the claws, they were quite difficult, because as you've seen, the weather was really wet and the buffaloes were kept extensively, so they were kept outside. So it was very difficult to clean the claws and not sort of like destroy the lesions. And so that was really difficult. And so on the 9th of January, the FMD suspicion was. On the 10th of January, the culling of the herd took place, and colleagues of the authority were there, and also colleagues from our institute were there. And on the 12th of January, that was the Sunday, we then continued the epidemiological investigations with the owner. And so what came out was that on the 5th of January, 2 animals died. And then the farmer actually called the veterinarian actually, and that's why I mention it here, the veterinarian, he was the last time he was on the farm nearly a year before that. So that was in January 2024. And so the farmer called the veterinarian, and the veterinarian sort of said, well, I'm sorry, they're dead. What am I supposed to do? So call the rendering company. And that's what he did. So he called the rendering company, and they said they will pick it up. And then on the next day, which was a Monday, the 3rd animal died. So he called again the rendering company, and the rendering company actually advised him to take that 3rd animal and take that to the laboratory. And so that was then investigated. And so what else? When we asked the farmer, like, when did he see what? On the 1st of January, he saw the first clinical signs because one of the cows actually didn't come up to get the favorite food. And then on the 3rd of January, there was a clear decrease in general food intake. But that was back to normal on the 8th. So just a week later, it was actually back to normal. When the animals were culled on the 10th of January, all 11 remaining animals, so he only had 14 water buffaloes and 3 died. So the 11 animals, they were culled and all of them were FMD virus and antibody positive. And that one animal on the 6th of January, that was antibody negative. It was virus positive, but antibody negative. And we couldn't get any samples of the 2 animals which died on the 5th because they went to the rendering company and were rendered. And so in the laboratory, on the 9th of January at quarter to 4 in the afternoon, there was the call from the regional laboratory that they have a positive real-time PCR in the postmortem samples of this water buffalo. And then they said they would bring the samples straight away to the FLI. And normally this journey takes about 4 hours, but the weather was so bad that the driver actually could only drive with 30 km/h on the Autobahn, on the motorway. And so finally he arrived at quarter to 1 in the night. And that's when Michael started to run the analysis. And then by 5 o'clock in the morning, he had the confirmation that the PCR was positive and also the LFD was positive. And then the authorities were notified and virus isolation and sequencing was initiated. And then the same day at 4 o'clock in the afternoon, so Michael didn't have much sleep during that night, there was the first indications of positive virus isolation. And then the original sample was found unsuitable to determine the serotype of antigen. And so they requested new samples. And then on Saturday, there was a successful virus isolation and the sequencing indicated serotype O. And then on Saturday at 12 o'clock, it was that the serotype O was confirmed. And then was also by ELISA confirmed. And then I have to minimize that, can't do that. Because now I missed. Hang on. Get there. And then on Saturday, so that was only virtually 2 days afterwards, we had the whole genome sequencing and the phylogenetic analysis completed. And then it was identified that it was the lineage O and MESA. And that was then sort of informed to all authorities. And then here, Michael gave me some information on what was done. We actually have this FMD antigen lateral flow device. And the lung homogenet, that was the one with the lowest CT value. And that's what they used to use that lateral flow device. And here on the right side, it's negative. And here you see it, you might not see it on the screen, but there's a very, very light red line there. So even the lateral flow device sort of gave a positive reaction. And these were the PCR results of the different organs, and the lung had the best results, or the lowest CT values. And that was used then for the sequencing for Sanger and NGS. At the same time, they used the lung for the virus isolation. And then they did also the in-house ELISA to find out the serotype. And even then, it was sort of like that. It was the highest value for the type O. And out of the blood, it was the ELISA was done for the non-structural protein, and that was negative, antibody negative. And these are some of the results of the herds in the of the herd which was culled. And you sort of see that all animals were positive in at least one of the samples which was taken. And the clawfoot lesions, they actually showed the lowest CT values. And when you look on the right side, that's the ELISA, and all of them were antibody positive, so all 11 animals. And then when they looked, we have in Germany, we have a vaccine bank, and then that's with Boehringer Ingelheim, and then it was looked like what is the best vaccine match. And based on the sequence data, Boehringer Ingelheim recommended the bivalent, so the Pan-Asia 2 and the Manisa. But then Germany activated the bank on the 20th of January, so that was just to be prepared and only used that Pan-Asia 2. And so the vaccine was delivered, but we actually never used that vaccine in Germany. But now some of this vaccine is actually used in Hungary and Slovakia. This one is where the phylogenetic, the virus sort of like originates from. And it seems to the closest match which was there was from an isolate from East Turkey, which was from December 24. But that virus sort of circulates in that area, North Iran, North Iraq, and in that area. So the sequence records are very sparse of that area. And so it could be some of that area. So the epidemiological work that continued, so we did the EPI investigation, then there was the EuVet mission, then there was a lot of work on the analysis and the communication of animal movements, then drafting and collating official statements, and then also daily meetings with the FLI colleagues and often with the ministry and also with other colleagues. And the immediate measures which were taken by the federal states Brandenburg and Berlin, both of them established a 72-hour standstill, and then Brandenburg extended that for another 48 hours, while Berlin extended that for another week. And you might sort of wonder why. The reason was during exactly that time, there was the Green Week in Berlin. It was on the not in the restriction zone, but it was on the west side of Berlin. But still, it was decided that it's just too risky. And this is a picture at the bottom. This is a picture from 24. And there you can see that's what they have the animals in that big halls in that exhibition. And in 2025, it was decided that no FMD susceptible animals could actually come to the exhibition. So there were only horses and rabbits, I think. And so when we looked at the epidemiological investigation, the water buffaloes, they were culled on the 10th of January. They were all PCR and antibody positive, while that animal on the 6th of January, that was only virus positive. And so when we all take this information together, that brings us to an introduction which is possible between the 15th of December and the end of December. So the second half of December, that's when we assume that the introduction was into the herd of buffaloes. And when we look at what pathways the virus could have taken, the epidemiological investigations actually could exclude quite a lot of the possible pathways. So there was no introduction via animals because the last animal was bought in 21. So that was June 2021. They didn't use any semen. They didn't buy any feed or bedding because they only used their own produced feed. The owners and the friends and so on, there were no travel-related activities in areas where FMD occurs. There was hardly any contact farms to that farm, so we were really lucky. The vehicles, he didn't use any other vehicles on those farms, and he didn't use any contaminated or any other equipment, so that can be excluded as well. And so from investigating all the other farms around that, and because there were hardly any contact farms, the introduction from other farms in Germany seems very unlikely. And also what we were very worried in the beginning, that it could have been introduced through wildlife. But in the meantime, we have investigated more than, I'm raising, more than 500 animals out of that small area. And so they were all negative. And so we do not think that it was introduced through wildlife, but we think it was introduced directly into the water buffalo herd probably through contaminated animal products. And what happened? WAOH war suspended the official FMD freedom. And then we were very lucky because we then established a containment zone. And this was then on the 12th of March, this was established. And we are very happy now with the 14th of April. So just this week, we regained the status FMD free without vaccination for the whole of Germany. And so in conclusions, I think we were very lucky because it was, we had a really early detection, at least in that, not necessarily in that farm, but in that area. We had a very low animal density in that area. I think that was one of our benefits. And the farm didn't have hardly any contact. So there was one contact where he brought feed there, and that contact farm was tested, but also culled. And I think also a great big advantage was that the veterinary authorities, they were acting very fast because they were really crisis proven due to ASF, because they had crisis center, they knew exactly what to do. And so I think that was really our luck. But we keep on saying that it's more important than ever to be vigilant, and any vesicular disease in cloven-hoofed animals requires a laboratory investigation to rule out FMD. So in this case, we were actually lucky because that buffalo which died, it was brought to the laboratory, and the laboratory first suspected blue tongue. And then they did a test, and it was on their normal routine that if blue tongue was negative, they would always test for FMD. And so that's what we actually can recommend. And with that, I would like to thank all my colleagues at the FLI, especially Michael Eschbaumer, and all the colleagues, especially in the federal states. And I would like to thank you for your attention, and I'm happy to take questions afterwards.
Oh, Carola, thank you so very much. I would like to congratulate Germany on your response and achieving FMD freedom without vaccination in what is a very short time scale. Yeah. So well done. There are some questions coming into the Q&A section, and in fact what you answered one of the questions, which was about the sequence of testing and why when you said that if it was not blue tongue virus we then tested for foot and mouth disease. Colleagues who are posting in the Q&A, Carola has very kindly said she will try to answer some of them in that written update. But others we will bring into the panel discussion. So thank you, Carola. That was so interesting.
You're welcome.
Lovely. I'm now going to move on to our next speaker, and we're really delighted that Polly Compston, who has worked in various roles, including clinical research, animal welfare and disease control in the UK and globally, with her current focus being strengthening livestock disease controls through her work at the EuFMD and also involvement in various veterinary committees, is here to speak to us. Just a small note, Polly also works part-time as a veterinary advisor in the Animal and Plant Health Agency in the UK, which is what I have also done in the past. So it's really lovely to have Polly here to speak to us on behalf of EuFMD. Polly, over to you.
Thank you. I will just share my screen. Hopefully that's now in presentation mode.
Yes, perfect. Thank you.
Brilliant. Well, thank you. And I want to start by saying a huge thank you to FEE for inviting me to speak here today on behalf of EuFMD. And I want to start by introducing EuFMD. We're the European Commission for the Control of Foot and Mouth Disease. And it's a commission of the FAO. Our core objective is to promote national and international action to prevent and control FMD in Europe. And so we operate to support our 39 member nations in the European region, and that's a geographical Europe rather than a sort of, it's not sort of the European Union, includes countries outside of that. And those member nations contribute alongside the EC to fund our work. So EuFMD was initiated 71 years ago when FMD was endemic in Europe to support coordinating control and vaccination. And today the work that we do is structured into three main components. So we characterise these as protect the livestock in Europe, which is mainly a process of risk monitoring and mitigation, particularly in neighbouring countries. We want to support the European veterinary services to have a high capacity to respond to crises. And we do that through a capacity development programme alongside developing tools and resources that provide support. And then finally, we work to improve control globally. So we contribute to global disease control strategies and vaccine security, because if there's effective disease control outside of our member nations, it follows that they'll be at less risk. And so when I heard in January that there was FMD in Europe, I have to admit I was surprised and a bit shocked and a bit worried. But it is worth remembering that FMD occurs in disease-free zones or countries almost every year, and most of those FMD outbreaks are brought under control quickly. But Europe remains under threat of a range of exotic diseases. And alongside the current FMD situation, if we look over the past 15 years, there have been outbreaks of several significant transboundary diseases, including sheeppox and goatpox, lumpy skin disease, and PPR. And Jane got in touch, asked me to put this presentation together and asked me to be thought-provoking. And so if you're wondering what this picture is, it's what artificial intelligence has defined as representing thought-provoking. But when I actually started thinking about it, I found it quite challenging. And I think that's because the headlines of what I'm going to say aren't particularly novel. So, for example, early detection and rapid response have a large impact on an outbreak's outcome. So contingency planning is essential. It's not new, but it can be really difficult to implement. So I want to try to explore some of the ways that EuFMD has experienced this and identify what lessons we've learned and the success factors that have come along the way. So a central part of EuFMD's programme is capacity development, because we believe that a veterinary workforce that understands FMD is going to respond quickly and appropriately to disease incursions. And that training should be practical, effective, and available in a range of different modalities. I'm sure we all recognise that listening doesn't equal knowledge, and knowledge doesn't necessarily result in practice. So it's really important that training activities are well designed and well delivered. And so effective capacity development can be delivered virtually, and EuFMD delivers a range of short and more in-depth courses on its online learning platform. But in-person opportunities are also really important. And one of our flagship programmes has been the real-time training, where European participants travel to a country where FMD is endemic. In this picture, this is in Kenya. And they're taken through a real outbreak investigation and able to see clinical disease in livestock. All of this is laid out in EuFMD's training menu. I've linked this at the end of the presentation, and actually all of the resources that I mentioned will be shared afterwards. And so that's a sort of peacetime activity, but one of the first things that we initiated to respond to the outbreak in Germany was to make sure that the resources that we built were accessible. So we created an open access FMD emergency response page and initiated a series of Ask the Experts webinars. And so when outbreaks occur, I think the demand for knowledge increases, as Jane alluded to earlier, but the time people have to absorb this information will be limited. And so the series of 8 webinars was able to provide useful, convenient information, and the demand for this was evident and is still evident. We had an average of 700 people attending each one. And I think, it's important to recognise that in the face of an outbreak, everyone is even busier than normal. So there's no need to reinvent the wheel. A lot of these resources already exist, but training resources do need to be short and snappy. I think EuFMD's trusted track record of training came into play as well in how well some of these resources were received. Another important part of contingency planning is ensuring that there's a range of easily accessible resources available that include practical standard operating procedures, decision-making tools, and strategy development support, because a veterinary workforce that can easily access information about FMD will make good decisions about disease control and prevention. A difficulty, though, is always balancing the amount of information that you need with having it in an organised or easy to access way. It can be really overwhelming, and there are very few ways of getting round that easily. This on the slide is called a Kanban style matrix display, which is just a lot of words, but essentially it's an intuitive grouping of pieces of information with successive categories, and it can be helpful for displaying this sort of information. This is EuFMD's Get Prepared wall. It's a central hub for everything you might need to prepare to or respond to disease incursion, organised in a user-friendly and relatively simple, not to mention multilingual way. So you can see here I don't know if hopefully you can see my mouse, but on the left-hand side of the screen is the Get Prepared wall. And if you click on, for example, farm biosecurity, you'll come to a place where all of the resources relating to farm biosecurity can be accessed. And so another aspect of providing FMD information is delivering a platform for information sharing. Because when outbreaks occur, context-specific control strategy should be informed by current scientific evidence from a range of disciplines. So all of those resources need to be placed into the context of the outbreak. So currently EuFMD is convening some technical working groups to facilitate these focused discussions around understanding transmission pathways, as well as analysing some of the possible scenarios that may happen. And these conversations, I think I wanted to touch on that they've emphasised really the importance of effective science communication to influence policy. So, for example, the EuFMDIS, it's a disease spread model shown in these pictures, and it's parameterized for a number of European countries to help, and it aims to help veterinary services understand the disease progression and consequences of an outbreak. And this is scenario planning, so hypothetical outbreaks. So these complex mathematical models are really useful for scenario planning, but they're only as good as their input data. And they're also always going to produce some results that carry uncertainty. So it's really important that the results of this kind of modelling information are communicated with that uncertainty and in a format that policymakers understand. And I just want to emphasise communication is only one aspect of behavioural science, but that's another really key discipline that needs to be included in these technical conversations. And I think now is being more so. Additionally, it's important that veterinary services work together so that they can develop effective and coordinated disease control strategies. And here I'm going to highlight one example of this, which is the Thrace programme. So it's an area that borders Bulgaria, Greece and Turkey, and EuFMD supported a work plan of coordinated surveillance in these areas that are historically at high risk for disease incursion. And this has resulted in early detection of transboundary disease outbreaks. Key aspects that have contributed to the success of this programme are sort of multiple, and they include having motivated policymakers who are willing to work together, but also that the programmes involved farmers, field vets, epidemiologists all together, ensuring that network of connection and communication. And I think from talking to my colleagues, the field level involvement in particular has been really important because it's enabled communication at the field level between countries, which I think can often be quite difficult to achieve. And looking at these regional approaches, it's also important to look at larger geographical regions to understand how the epidemiology of transboundary diseases impacts the risk that they present to Europe. We know that global FMD surveillance has some significant gaps, and that's been highlighted in some of the sequencing of recent viral incursions. I think having an expansive view, of where risks will occur needs to be balanced with local needs. So EuFMD uses a risk management tool to prioritise areas where there's an increased risk of probability of disease occurring and incurring from. So approaching disease control with a global perspective can help to ensure targeted allocation of resources. In other words, by understanding where risks are most likely to occur, you can target, for example, sample shipment, surveillance, and relationships with veterinary services strategically. So discussing global surveillance leads to discussing vaccination. Vaccination is an important tool that should be available during FMD outbreaks, but we know that there are gaps in vaccine security. FMD viruses are serologically diverse, and so vaccines need to be matched to the serotype and strain an animal is exposed to. And we've already heard that today. You can see in this map, which I credit Purbright with, that there's predictable movements between some viral pools in the world, shown by the green arrows. But there are also some larger, unpredictable jumps that viral lineages made, indicated by the red arrows. And the point is that when an FMD outbreak occurs, identifying a suitable vaccine may not be simple. I'm not going to go into all of the intricacies of vaccine security that are shown in this conceptual diagram that we have, because it's comprised of many different things, but that does mean it requires multifaceted solutions. And this requirement for vaccine matching demonstrates the importance of global surveillance and full genome sequencing. So we have tools like Pragmatist that prioritise FMD antigens based on the most recent virological surveillance data. And this can help to identify, for example, the right antigens for vaccine banks, but they're only ever going to be as good as the surveillance data that they're based on. And therefore, the last thing I wanted to highlight is some work EuFMD is doing to make sure that high quality vaccines are available and accessible. So when an outbreak occurs, for vaccination to be an option, you need a suitable vaccine. That's just common sense. But there's no universal system for assessing vaccine quality or understanding a vaccine's properties. And it also doesn't make sense to maintain market authorizations for all of the possible vaccines that could be required, but probably never will be. This means that in emergency situations, authorities often need to source FMD vaccines from countries with poorly developed regulatory systems. So to resolve these challenges, EuFMD has established a pre-qualification scheme, giving an internationally recognised and independent source of information on the quality of veterinary vaccines, starting with FMD vaccines. And so far, there are 4 on this list, which is available online. So in conclusion, I'm nearly out of time, so I'm just going to do the highlights here. Contingency planning is essential, using a systems approach that's underpinned by science and delivered with transparency and in collaboration. I can't go without acknowledging the EuFMD team. Most of what I've presented here today is, if not all, has been done by this incredible group of intelligent, knowledgeable, kind and dedicated professionals, and it's a privilege to work with them. I've put the resources slide in, so these are accessible, and I know they'll be shared afterwards, and I want to thank you for your time.
Thank you, Holly, and your canine companion on your screensaver there. Thank you, everyone. I just wanted to comment that sometimes the thought-provoking aspect is actually recognizing what works well and then helping teams to deliver that. So, Polly, I think you explained that incredibly well. Karen has asked whether the EU FMD tools are freely available to veterinary practitioners in the field, and they are. So lots of information there. We are now going to start our panel. However, we have some sad news in the fact that our Chief Veterinary Officer from Hungary, Szabolcs Pastor, has unfortunately had to send his apologies. He's been called away at short notice to an urgent official engagement. And I think also, as Polly noted, everyone, particularly Chief Veterinary Officers, are incredibly busy when they're dealing with a notifiable disease. So I'm just going to take this moment to send our best wishes to Szabolcs and hope that his ongoing work to address the cases in Hungary goes well. We're hoping soon also that Martin Chudý, who is the Slovakian Chief Veterinary Officer, will be able to join us for the panel. I don't think he has yet arrived, but as soon as he does, he will be able to join us and maybe speak a little bit about the Slovakian response. So in the meantime, we have our wonderful panel members, Carola and Polly. And I wonder if perhaps we could take down the slide and start the Q&A. There we go. Thank you. So I'm going to start with a couple of simple questions. All these things are meant to be simple, which are a little bit more related to the speakers. And Carola, in particular, a little bit more, many people are asking about the epidemiology of the case in Germany and the conclusions that you have eventually drawn. You were able to point out the pathways that were excluded. But what was remaining, and what do we think was the route of incursion?
There were many pathways which we actually excluded, but we do not have an evidence that we can really prove how it got in there. But the location of the farm is very close to Berlin. Berlin has got lots of visitors, lots of people from all nationalities. And this area where the farm is actually a very well used area for dog walking. And quite a lot of people actually go there and just take pictures of the buffaloes and so on. So we cannot exclude that some people might have brought some contaminated food and thrown it into the buffalo. I think that's at least the pathway which is most likeliest. All the other pathways we actually could exclude because there is no, like there was a question in the chat about wind, but there was no any other a positive herd. And I mean, they tested not only herds in the 10-kilometer zone, but they also tested all animals which were actually going out from Brandenburg, so that's the whole federal state, so that's probably a range of up to 30 and 40 kilometers, and all the animals which actually came out of that area and went either into other areas of Germany or into other member states, they were all tested for foot-and-mouth disease and they were all negative. So it's very unlikely that we actually missed another herd which was positive for foot-and-mouth disease and which could have sort of like infected this one. So we assume that it's really the direct contaminated material which came into the herd.
Yes, thank you, Cara. And we would expect that to not necessarily be through the routes, the sort of formal commercial trade routes, because there is also a question, and I was hoping to wait for our Chief Veterinary Officers, but I think this is a question that I can pose to both you and Polly, Carola, about, how do we protect ourselves through those import pathways? And one of the questions was, why are we importing animals and animal products from endemic areas? So it'd be very interesting for both of your views on that.
I think for many areas where we know it's FMD, it's forbidden to bring products in. But still, if you look at Europe, I mean, there are no borders, and people just bring things with them. And I mean, it even happens in Ireland, in states which have got an island like Australia and New Zealand, and they've got a very strong border control where they actually check every single bag which comes in, and they always find food. So people, although they know they shouldn't bring any food, and sometimes people don't know, and they don't know about the risks which they actually pose. And I think that's a danger of our society, and especially, and I think that's a risk which actually increases, because people, they sort of like walk with their dogs, and then they sort of see those lovely buffaloes, and then they say, oh, we want something, we give them something good, and we throw something in there. We have the same situation with African swine fever, where people just sort of like feed pigs, despite the fact that there are lots of signs there, please do not feed us. And I think that sort of, yeah, as Jane said, it's not the legal way. I think it's more the illegal ways which products come into our countries.
Thank you, Carola. And Polly, I think that's a really good segue to ask your perspective around, the education and the social engagement. So with wider society, do you have any comments from an EuFMD perspective on that?
Yes, and I agree. I think, from a UK perspective, in the last couple of days, we've just banned all animal products coming from the EU, which has been quite a big change in our policy, coming in from with tourists and visitors, obviously not.
Yes, personal imports.
Yes, yes. But I think it is important to recognise that unless we all live in bubbles, there's always going to be a risk. And it's the Swiss cheese analogy of biosecurity, in that, it's very likely that virus as a virus is coming into countries in a dynamic way all the time. It's just whether it's getting to a susceptible animal and then clinical disease is developing. And disease is just an inherent risk in our global world. If we want a life where we travel and where we see different things, those risks are going to come along with it. I think in terms of how to engage with the general public on this, I think there's a role for transparency. I think generally people don't have a good view on how much work goes into ensuring that our food is safe and that our animals are healthy. And so the visibility of the public agencies that are doing that, I think, could be increased. I think that building really trusted and transparent relationships between veterinary services and members of the public, and including our small animal colleagues in that, so that we are a sort of united profession that can continue to communicate about these things. So it's not just sort of the public vets and the private vets, that we're all together and able to build those relationships. But it's difficult because people don't like risk, and they like things that are black and white, and disease isn't black and white. So it's communicating that when we can.
Thank you both. So I'm now going to ask a question actually about vaccination. It brings a few of the questions that are in the chat together. And what it is really, how do we understand, a little bit extending on your presentation, Polly, when and how to use vaccination, what the barriers are, in particular from trade. There is a question about the status of being free from foot and mouth disease with or without vaccination, and what the exit strategy is. But also perhaps social acceptability of vaccination, given we have all, as a society, been through the trauma of COVID and the challenges of mandatory vaccination in that space. So, Polly, that wasn't a simple question. It was more what are your reflections on the barriers to applying vaccination in response to a foot and mouth disease outbreak?
Yeah, no, that's not a simple question. So from my perspective, I think that the barriers to it does depend on the farming systems that are impacted by disease, and because that will relate to the experience of those farmers and those communities with vaccination more widely, and also with things like higher herd health and the implications that has for trade and their integration into international trade pathways. Because I think that's a big thing if you are impacted by something. If you're in a community that has FMD, but you're not part of some integrated large trade pathways, it's going to be much harder to accept any of the control strategies. With vaccination, I mean, I would probably avoid getting into the debate about whether, there's an interesting paper about whether the status of countries that vaccinate against FMD should have such a different status to those countries that are free without vaccination. I think that's an ongoing debate in some areas. I think barriers, it is difficult. FMD is emotional and political enough, and it can be really difficult to accept that you're going to vaccinate animals to cull, because if you're vaccinating, aren't you protecting them? And that can be a difficult thing to communicate. And I think if we look more globally, there are also cases where there is sort of just a general distrust of vaccine and government delivered vaccination programs. And it's important that they're not seen as a way of harvesting information from farmers, and so that everything is transparent. That's only a tiny bit of your question, but hopefully that's a few
absolutely
points.
It was a huge question, in part because we're trying to admit Martin into the webinar to join the panel, and we're having a little trouble with the technology, so our apologies for that. That's part of the delay. Carola, you had prepared and you had obtained some vaccines in Germany which were not used. Were there any sort of challenges in then sharing those vaccines across with Hungary and Slovakia, or has that actually gone very smoothly?
I think that has gone really, really very smoothly. I think from the Hungarian and Slovakian side, and as well as from the German side. So I think that was really. I think the Slovakian colleagues, or they actually sent an army plane onto to Munich airport, and the veterinarians here were very happy that they actually were allowed to drive onto the airfield, and so I think that went really smooth.
Oh, that's wonderful, Carola. Thank you. And wonderful. With apologies for the delay, but perfect timing, because I'm about to ask a question, Martin, on that I hope that you will be able to answer. We are joined by Martin Chudý, who is the Slovakian Chief Veterinary Officer, and he has been the veterinary attaché at the Slovakian Permanent Representation to the EU in Brussels, head of the Animal Health and Welfare Department at the Slovak Republic State Veterinary and Food Administration. So knows all about coordination and emergency response. Welcome, Martin. This is very rapid for you. I have a question which I think is really interesting, and I'd be grateful for you to respond. This is about how much decision-making freedom each EU member states have in terms of, and the actual question is, waiting for test results before carrying out preventive culling, the use of emergency vaccinations without killing animals, and so on. But I think it's a more general question about, and an opportunity for you to maybe speak a little bit about the Slovakian response. Welcome.
Yes, good afternoon to everybody. Can you hear me? I am here 45 minutes, but there was a problem with the connection. Good afternoon, Jane. It's pleasure for me to see you again on the PAF committee in Brussels in one room. And greetings to all the colleagues. I see up to 400 people connected. It's fine. So I have heard what have you discussed. And I will not repeat everything from the beginning, what's happened from 21st of March in my country, but for the time being, we are now in number six outbreak 2 weeks ago confirmed. And what is important, what you have discussed about the vaccination, what we did. Excellent work with the German colleagues, because within 6 hours the vaccines from Germany were delivered to Slovakia, and it was really very good, because immediately after confirming the first positive case, and it was a problem because we confirmed 3 outbreaks at the same time on one day, and it was more or less, how to say honestly, disaster, because you don't know where the exactly virus is. You have in one area and you have 3 outbreaks, 3 holdings. The distance from them is up to 10 kilometers from each other, and you don't know really where the virus is only in these 3 farms, or you have the virus more spread in also small holdings, more holdings, etc., etc. Then what we started, there was the first outbreak. We started with eradication immediately 1 day after confirming this outbreak, and parallel, we have started with suppressive vaccination of 2 outstanding outbreaks. Everybody knows that this vaccination in the European Union is only allowed to, how to say, to postpone the killing of animals, to have this umbrella, to have time to do something, because you are not able to eradicate, to kill the animals within 1 day if you have the 3 outbreaks with more than 3,000 animals there. It's almost impossible. So what we also recognize, and we have seen that this vaccine, after 4, 3, even 5 days, there were no more clinical signs by the animals. It goes rapidly down after 2-3 days also. And also what was important, that we have confirmed this serotype O, which was in Germany, and we use this vaccine also. We passed the vaccine, that was good vaccine. And for normal vaccination, as a preventive vaccination, yes, by my opinion, we should start discuss what will we do in the future, because also the pressure from the citizens, from the public, from politicians is very high. Why we are killing the animals also on the farms? If we have vaccines available, they can protect the animals. That's the question always. And it's up to us to explain them the difference between 2 types of vaccination and what we exactly doing. Indeed, we have also used this vaccination in one contact farm, where we have direct contact from one outbreak to this contact farm, that some employees visited this farm, and there was maybe this within this incubation period, and it was necessary to do something beforehand, that we not to wait for confirming the virus there. So we vaccinate the animals, and subsequently we started with the depopulation of this contact farm. From my point of view, this vaccination works. From my point of view, we are in the different position than in 40 years ago, because everybody knows, and we have these books, and we have these explanations, we have experiences that if we have a vaccine, there is a live virus instead of this type what we have now. It's completely different. It's completely different. Of course, we should also change our meaning. We should also change our approach. That there is no food safety approach, the food safety issue for the people, as regards the animals they are vaccinated. Even protective vaccination, not suppressive vaccination, because suppressive vaccination we are killing the animals right now. But for the future, really, to discuss, to have scientific discussion how to move forward, because we have now the policy without vaccination, there are some barriers, etc., etc. For the time being in Slovakia, we don't have any animals, they are vaccinated and they are still alive. They have been eradicated. And this decision is not so easy. And what you have discussed, preparedness, everything. Via EuFMD, we are sitting here both with Pavel. We were in Uganda. We discussed with the FMD issues. Everybody knows us. Everybody knows what to do. Yes, you know what to do, but everything will change after receiving first positive results from the laboratory. And you have to be then pragmatic, and you
need to actually implement. Yes.
And you have to implement something within several hours.
Yeah.
People, sources, everything. What to do? What really to do? And now, okay, we have some experience how to behave, how to tackle this issue. But it's always what is important, and what I discussed first is to stop movement. No movement of animals. In Slovakia still there is very, very limited movement of animals within Slovakia, not only in the part of Slovakia which is infected. Slovakia, I have closed all zoos, no exhibitions. Only also transit through Slovakia is only possible where this white part, not infected area or food restricted zone. Also till today, it will be tomorrow 4 weeks. There is the standstill of movement of animals for 90%, because this 10% is direct way from holding to the slaughterhouse. And then, yes, epidemiological investigation. You have to trace everything. Now, we do not expect the outbreaks from the animals, but everything what is dangerous, there are people. You really don't know, still don't know, because the people they are moving, they are there. And if you don't have the channels, that you have one farm, and on that farm you have 10 people, they are working there, or they are visiting only this one farm. And in these 3 outbreaks, for example, in my country, there were one owner, and also the people moved from one farm to another. There is a danger. There is a danger to trace where they moved, and also trucks. And that's big problem. Also, first vaccination, yes. To discuss further what can we do, and also the implication for international trade and for the status, yes. And then how to tackle the issue. You have outbreaks, and you have to eradicate them in the quickest possible way. That's my first observation. What can I say to you? And of course, we have National Crisis Center. We have very good cooperation with the police, with the soldiers, with all relevant. How to also provide this eradication is not so easy. If you have only one rendering plant, you have to decide burning or burial, what to do.
Yes,
within 1 day, within 2 days.
Yes, yeah. Now I'm just going to take a little moment to check with everyone, because we started a little bit late, Martin, with you.
Of course.
I am happy to continue, if everyone else is happy, just to continue a little longer with this panel discussion. I know some people will need to leave, but we are recording, so there will be an opportunity for us just to perhaps explore a couple more areas with you. I'm looking to Vibka and Alice just to check that that's okay, if you could nod. That's wonderful. I think, you know, what you have described is part of the challenge, and I'm really glad that you heard, you know, both Carola and Polly's presentations and talking about actually helping people to deliver what we know that can work. However, there's so much more to discuss. So I'd like the people who are still on the call to put into the Q&A any further questions that we will then work with the panelists to provide responses to. But also, please, can you put in the panel whether there into the Q&A, whether there are opportunities for us to have further discussions. If there is an area that you would like us to cover that we could explore having another webinar. There is so much more that we could discuss on this area, including, and you touched on it, and this is what I would like to ask you, Martin, the communication with the farmers, the social acceptance of the culling policy, and how we can perhaps work across, not just in the EU, but globally, to work out how best to manage foot and mouth disease outbreaks in the future, where we perhaps do not need to cull so many animals and essentially have the sort of moral challenge and the food waste that comes with that, but also how we can protect those who are not directly affected. You spoke about the movement controls, and that's a really big challenge, including for animal welfare for everyone in the country. So, Martin, what are your thoughts on how we can address not just what you're doing now, but how we can learn from it and perhaps do it better in the future?
Yes, thank you for the questions. I'll focus very fast for the farmers, of infected farms. You have to speak with them very carefully. You have to explain them. There is on the one hand, you have the legislation. You have everything what is written there that you have to kill the animals because there is no further option. Second is also the compensations. Compensations, you have to have this feedback position that from the ministry they know that we will kill the animals and they will go back the money. But for the citizens, they do not understand. Really, they do not understand. And I try to explain them that is there's this high virulent disease. We have very high mortality. Morbidity yes. is up to 100%. It goes very fast, and we have to stop the virus somewhere, and then you have also to explain them that in the past there were some problems that the animals they have recovered. From the health point of view, they can further transmit the virus. They still can have the virus in their body, and they are still the source of the virus for another animals. That also explanation that really we have to stop. We have to stop it. But they are asking me also for normal preventive vaccination, and I answered what I said before. We should also distinguish between two types of vaccination, and we should discuss amongst the expert what will be benefit from the vaccination to use the vaccine we have right now, and what we know about the vaccination, without having problems after that the vaccinated animals are there, and it will not stop the trade. It will not stop the trade. We are in this 3 weeks period, and we still don't know exactly all the aspects how to answer for all these elements. But we will try to explain them that it's not so easy, and if I kill, for example, these 8,000 animals, I can protect 100,000 animals that they can be somewhere further. If I have new outbreaks, I have to establish 3 and 10 kilometer further zone, and I have there a lot of new holdings. They will be under restriction, and there will be not only the problem that the virus is close to this farm, but is animal welfare problem. Today we have also the problem with pigs. You have
Yes.
pigs, they are healthy, and you have to move with the animals to the slaughterhouses. It's not only the outbreaks, it's also the impact for the food, and you have to stop virus somewhere. You have to stop virus somewhere. For that reason, you have to be 1 or 2 steps before this virus, not to wait. That's my answer for the time being.
That is a wonderful answer, Martin. I would like to just take this opportunity to ask our other panelists for any final takeaway messages. And I think then we do need to close what has been a really fabulous meeting and webinar. And as I say, please do, attendees, in the Q&A, put any areas that you'd like to explore more, because we can look at setting up a further webinar, and also we will hopefully discuss the foot and mouth disease at the FVE General Assembly in June. So if I could come to Carola, do you have a final takeaway message?
I think my final takeaway message is really to test for foot and mouth disease, and to keep foot and mouth disease in the back of your brain, and to be aware of it. I think, as Martin also has mentioned, the early detection, that's the key. And Jane mentioned it as well. So I think that's where we have to get to.
Thank you, Carola. Polly?
I think for me, my take home is the importance of transparency and collaboration. It's so important for us to be learning from each other during these outbreak events, but also building these connections, not just within the veterinary profession, but also with the owners of these animals, so that they can be involved in outbreak response, and that the control measures can be designed to fit as much as they can with their objectives and industries.
Thank you. So we have preparedness, we have transparency and collaboration. Martin, do you have anything further that you would like to just close on?
No. I wish you all the best, and please keep fingers crossed, because we are now 14, more or less 14 days after confirming of the last. And really, what is important, really, what has been said by Carola, this is early detection. Early detection is the key. Stop moving. Early detection. You have to go there before animals have shown the clinical signs. Oronasal swabs, and then you can be 1 or 2 steps before this virus, and you can see 1 or 3 days before the virus is there. 1 to 3 days before first clinical signs can be observed. And if you have the swabs and then the results of PCR, the negative, you can be more or less sure that in that holding it's still okay. But you have to repeat the investigation. You have to repeat the sampling again after 5-7 days, because of this incubation period. What we did in some areas, we checked it when we took the samples 2-3 times, and we will continue. But we will go further and further into the Slovak territory to be sure that everything is fine. Again, keep fingers crossed, and we will see after Easter how the situation will develop.
Wonderful. Martin, thank you. So it just leaves it to me to close the webinar. I would like to say, first of all, congratulations to Germany for your eradication, successful eradication. I would like to say thank you to Polly, including all of the EuFMD work and all of the resources that are available to you all through EuFMD. And I would like to wish Martin and in his absence, Szabolcs, all the best with your ongoing efforts. And as you say, fingers crossed that we can rapidly control this outbreak, and then learn from it, and think about how we will continue to remain alert and prepared and transparent, and work across the whole system, from the farm all the way to the fork, as we say. So thank you everyone for your attention, for your wonderful questions. We will have the recording shared. We will try to respond to the questions, and we will also see if we can think about further engagement, because we have still so much more food for thought. Thank you, everyone, and I will wish you a good and happy time over, hopefully a peaceful Easter. Thank you.
Thank
Bye-bye,
you.
everyone.
Bye.
Thank you. Bye-bye.